I'm Bonnie Lettow. I am currently working in the finance department here at Franklin General, and I've been here since September of 2013. I'm kind of a North Iowa girl, grew up in Mason City, and our family's been living in Hampton for 8 years. Like I mentioned earlier, I started in early September of 2013, and October is typically Breast Cancer Awareness Month. So shortly after I started and was training, the gals in the radiology department were going around and they kind of had doing a campaign and trying to see if they could get as many people in the facility as possible signed up to have a mammogram. And at that point I said, great, I can do that, but I've typically do these in January and at a different facility. And they're like, oh, no problem. We'll go ahead and get you rescheduled for down here. We'll move your appointment for you. And I thought, oh, okay. And at first I was a little hesitant. I thought, well, I know these people now. Maybe I would rather, continue to go where I had gone before. But I wanted to support the facility. And so I said, sure, great. Go ahead and get me rescheduled. So they did that. And for February. February was getting near. I was working on budget. I was super busy, super stressed out. And I thought, I've had 14 of these, 14 in a row. I've been really faithful about this and they've all been fine. I'm really busy. I think maybe I'll just cancel this one. And I'm totally sure that if I'd have had that appointment in Mason City, I would have canceled it. I wouldn't have felt a sense of accountability or anything for that. So I think I would have just picked up the phone and said, nope, I can't make it this year. But I didn't have the heart to say that to my coworkers here at Franklin General. I thought, oh, they're going to guilt trip me. They're going to say, hey, you can take a half an hour and do this. So the day came and I was still intending to cancel it. And I looked at the clock and I thought, no, I'm just going to go do it. It's fine. I can take the time. So I went down and did it. And found out ultimately after that and a bunch of other follow-up tests that I had breast cancer. At my age and based on my history, this was something that I never saw coming. And I think that in retrospect, I feel very fortunate because of the way all of that worked out. I would have put that off. I really would have. And I think that my prognosis and my treatment would have been a lot different if I'd have waited. I ended up being lucky. It was early stage, and there were women that I know that I'm friends with that got diagnosed at the same time that had put it off, and their treatment was vastly more invasive and difficult, and a couple of them are still going through it a year and a half later. And I just feel like it's one of those tests like colonoscopies that they're uncomfortable. Nobody likes to do them. But I think that if you go and you catch something early, your treatment is so much, you have so many more options and it's less invasive and it takes a shorter period of time. So I feel really fortunate that it worked out the way it did. And I went ahead and went through with it, and that I was able to have those options that if I'd have waited, it would have been different. I would say that the benefit, at the time, I thought it was actually kind of a downside that I was going to be switching and working with healthcare providers that I knew now personally, and I thought I'm going to feel really self-conscious, but it actually ended up being the exact opposite. When it became apparent that I was going to need additional diagnosis and additional treatment, from that day forward, the way I was treated and the care I received here, actually having that personal relationship with them made all the difference. Not just that day, but then with the follow-up and for them to be checking in on me and saying, hey, how are you doing? And it just ended up being, I was really glad that it worked out the way it did. I think that because so much of what we do here is with people that there's these family relationships and these friendships and everything that people have in this area, chances are a lot of the patients that come in through our doors and are going through, the radiology department or the surgery department, the staff knows them. and they do a great job of dealing with them in a really neutral and professional and caring way, and I didn't feel uncomfortable at all. It really, the support I had here after that, and I didn't mention it earlier, but just even with the administrative staff and everything, I don't know that I would have had that otherwise, because I think I probably would have not told people, or I tried to hide it, or, you know, and because it was a little bit more, I was going through it with everybody, that really helped a lot. It really did. I didn't realize it at the time, but it made a huge difference. So, yeah, worked out really well. So, yeah.